lower respiratory tract infections may increase the risk of obstructive sleep apnea. Pediatric obstructive sleep apnea has an incidence rate of 1 to 6%. Untreated obstructive sleep apnea has clinical and behavioral complications like impaired attention, hyperactivity, learning disorders, depression, and systemic and pulmonary hypertension. Investigators conducted a retrospective study to assess the association between lower respiratory tract infection in young children and a subsequent diagnosis of obstructive sleep apnea. Lower respiratory infections were classified as mild if the patient was managed as an outpatient, and it was considered as severe if the child was hospitalized. The primary study outcome was the diagnosis of obstructive sleep apnea at the age of 5 years. The data were analyzed on 2,962 children. Among these study participants, 21% were diagnosed with a lower respiratory infection prior to 2 years of age, including 63% with a mild infection and 37% with a severe infection. The obstructive sleep apnea was diagnosed before the age of 5 years in 230 children. Among those with obstructive sleep apnea, 72 children had a previous diagnosis of lower respiratory infection. The median time from LRI to first diagnosis was 23 and 25.5 months respectively for those with mild and severe LRI. So the authors concluded that occurrence of LRI prior to 2 years of age is associated with an increased risk of subsequent diagnosis of obstructive sleep apnea, and that the risk was higher in those with severe disease. The current study provides further support for maternal and infant immunization against respiratory syncytial and influenza virus infections, which are a common cause of hospitalization in young children. Thank you.